For the budget for 25, I think it's going to be a very interesting year where we are really hoping that the government really focuses on healthcare as an area of investment, as an area for taxation, as an area for really growth and boosting infrastructure in the country. We've always focused on healthcare wanting more accessibility, more affordability for all the citizens of the country. And to do this, we need to make a few changes. Number one, we need to really look at the taxation. While healthcare gets all the input taxes of GST, we get no offset at all. And this increases the input cost for healthcare providers and therefore increases the cost for consumers. This is an easy fix for the government to make to be able to really get healthcare within the GST bucket so that either 0% or 5% there is an offset available for the providers to be made more cheaper for the patients as well. The second thing that we can do on the taxes front is to really look at the import duties and the surcharges that are being charged for chemicals, kits, equipment, and all kinds of other life-saving devices as well. As we get import charges on these, again, these get passed on to the patient as well. This, we believe, is another opportunity for the government to really rationalize and make healthcare more affordable for Indians across the country. I think the second area to focus on beyond taxes is really to look at R&D. We need to see innovation in the country, and innovation can only be driven when people are doing new things, are experimenting, are really investing in the future. Now, unless we have a special treatment for R&D, from a P&L perspective, this doesn't actually end up happening. Pharma company gets some special exemptions for R&D investments, and I would urge the government to look at doing the same for the rest of healthcare, where companies like ours and others can actually really look at investing in R&D in a big way, because we know that this is more long-term and not just a short-term expenditure. The third area that I think we really need to focus on is more PPPs. The government has certainly tried to be a provider themselves, and through Ayushman Bharat, they have tried to do a PPP that allows them to do it in a great way. I think making these PPPs again better structured would really help Indians get better provision of health.